Good morning, Stoma Warrior here. Struggling today. I've done so many videos lately about the positives and how you get on and you do things, and I just think it's fair that sometimes I share that it's not all rosy and dandy, because that's not doing any justice to everybody out there that's suffering. So yesterday morning I started getting really bad spasms, just really gentle to start with, say bad but gentle compared to now, in my stomach. I started getting bloated. I'm trying to establish what I've eaten. I keep getting these mini partial blockages, mini whopping partial blockages, that tend to sorry, I'm not with it really. I've had 10 minutes sleep according to my watch. I had about half an hour again this morning, and I've taken oxycodone because it's the only really strong painkiller I can use without damaging anything in my stomach, and tramadol makes me itch. It says itching. So I had a meal, went out, pizza, had some olives, did have a couple of sun-dried tomatoes on the top of my pizza, and I also had, possibly stupidly, some mini figs for pudding. Now, not had them before. Sometimes I take my pouch, my stoma, for granted that it can cope with everything now if I chew. But I've looked back and reflected. This is my 6th partial blockage. Apparently, in 6 months, so it's getting quite bad. So how do they feel? So it's really hard to describe this, mainly because I've just completed a exercise I'd set myself on my pain journey, which is how to sorry, I love that picture. How to repicture my pain, how to use different words. So I'll tell you how it feels. There's cramps that I've now recalling my abs working out. It's got to be a positive thing. So my abs are doing their own exercise. It's stabbing, which I'm now telling myself it's sparkling. I can't use the nice words today. It's gut-wrenching. I feel like I have something inside my stomach and it's got hold of my bowel, and it is twisting, turning, pulling, squashing. And that spasm lasts a good 30 seconds, which doesn't sound long, but it is in reality. And then as it releases, sorry, I've got one coming, then the pain and the aching and the shooting pain around it really kicks in. So I also get incredibly bloated. This is going to be gorgeous, I warn you, because I've still got my pyjamas on. It's only 2 o'clock in the afternoon. But as you can see, I'm pretty bloated. Bearing in mind my stomach's down here somewhere. I'm only a size 12 to 14 at the moment. I'll probably quite comfortably be about a 20, which is nothing wrong with that, but obviously it's a bit more than me. So passing purely water, some such contradiction of myself here because I'm so tired, passing water with some bits in it, but nothing substantial. I've been using Buscopan to help control the spasms. Somebody did mention they didn't know whether that stopped your stomach trying to move a blockage, but for me it stops the intensity of the spasms and relaxes it, so hopefully things can pass naturally. I've used the rocket fuel this morning. I had a can of full fat Coke, which I really don't like because it makes teeth feel very and horrible. And as any other stone person out there will know, you've got nowhere for wind to go apart from burp bag. So I've been blowing up my bag quite a bit since, but I'm passing so much liquid that I'm really dehydrated. Dry mouth. I'm drinking hydration solution purely. I don't make my own because I don't like it, so I use one called Elite Health Span, which is really good. It's got all the magnesium, all the sodium, everything you need in it, just to help me through. So keep saying to myself, don't want to go to hospital, don't want to go to hospital. So I'm not going to go to hospital because last time I went, they give you a drip, which does help. They don't do anything else. I'm allergic to morphine, so that's no go. So I'm going to stick at home. I've got oxycodone, which isn't the best drug to use because obviously it's quite high class, but I only ever rarely use them in a real extreme situations. This is probably the first time in about 6 months, so the last ones haven't got quite as bad as this. Anyway, I'm just popping in. I'm rambling on, I don't really know why. Just felt I wanted to share that it's not always rosy. I always try and put across a really positive side of things, but as I say, it doesn't always do justice to people out there really struggling, because I do struggle. It is a huge struggle. I am a positive person and I do try to focus on that, because if your brain works, then your body tends to follow, most times. I'm waiting at the moment for a endoscope pill capsule, which I'm having done in 2 weeks' time. Fascinating thing. You swallow like a pill, apparently the size of a hay fever tablet. Hopefully they're not too big. And that takes film shots every sort of few seconds all the way through your system from your mouth to the end of my stoma, so when it comes out in my bag. And this one also takes biopsies, which I found fascinating, so I've googled it, and it has little tentacles that come out, little grabbers, and then it has a sticky pad that it vacuums them up. Absolutely fascinated. Slightly petrified it's going to block, because I think whatever this is blocking, I say a partial blockage every time because I'm still passing tons of water, so it's almost like a narrowing or a stricture, I hate that word. It could be my scar tissue. So I think coming up in the next year I'm going to have some surgeries, or the next few years, hopefully not too soon, as I started a new job last Monday, and I'm slightly concerned I'm not going to make it in there tomorrow. Once I'm fully established, I'll be able to work from home in these instances, but we'll see how I go in the morning. If it's passing and painkillers get me through, then I will. And as long as I get some sleep, because I'm not kidding you, I really did only have 10 minutes. I've had half an hour this morning, and I'm going to shut my eyes in a minute and try and get some more. So anyway, I just wanted to pop in because blockage, partial blockage with a stoma is a lot different to your normal disease. Obviously with that you get the spasms, you get the urgency, you get the blood often. I haven't noticed any blood as yet, fingers crossed, and obviously I don't get the urgency. The only urgency I have is when my bag inflates so much I wake up with a blimp on my stomach and I have to carry it to the toilet and hope I get there on time and hope that it doesn't just explode and go everywhere. But anyway, just waffling again. Just wanted to check in and catch up really and let you know how it feels to have a partial blockage with an ileostomy. Not very nice. So big hugs to everyone else out there who's suffering today, and positive pain thoughts. It's going to get better. It can't get worse. No, I will recover from this. I will bounce back. It came on so suddenly yesterday when I was walking on the beach, unfortunately, dipping my toes in the sand. So I went from a beautiful day to a mush, to a mess. So anything can happen today. Hopefully I bounce back, but I'm waffling again. That's the tiredness. So I'm going to say goodbye and thank you for checking in with me. And fingers crossed we bust all this soon. Take care.